This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning and welcome into Mon Health Talk. I'm Dave Wilson. Our guest this morning is Anna DeFazio, Director of Nursing Women's Services at Mon Health Medical Center Family Birth Center. We're going to be talking naturally about the Mon Health Medical Center Family Birth Center. Anna, good morning. Thanks for coming on the show.
Good morning. Thanks for having me.
We will dive into the topic at hand in just a little bit, but as you have probably already been warned, you have to talk about yourself. So I hope you are ready to talk about yourself. Just tell people a little bit about your background, where you grew up, where you went to school, and your journey that brought you to the Mon Health system.
Sure. So I grew up in Uniontown, Pennsylvania, but I was privy to the West Virginia culture. My mom was born and raised in Clarksburg, West Virginia, so there's nothing like a fresh D'Annunzio pepperoni roll. I received my degree from Wheeling Jesuit University, and then I was brought to the facility. Actually, I had several friends that worked at the hospital, and they told me all about their experiences, how much they loved it here, and I had to be a part of that.
So what led you into the specialty of working in nursing and working in particular in women's services?
So as a mom myself, I'll never forget the nurses who cared for me during those times. So now my passion has become caring for and supporting the woman as she begins her journey into motherhood. It's been an honor to be a part of their story during such a pivotal moment, and I'm proud to support those moms as they start their journey as well. You know,
do you find when it comes to nurses, at least this has been my experience, I've had grandparents in hospitals, and luckily I've only had to go, see the doctor every now and again, but the nurses, not to downplay what the doctors do. They're great, but nurses make such the difference. And that's what I can remember my grandparents talking about. And when folks go, how much they like this nurse, how much they like that nurse. And, that nurse was so nice, and I really liked them. Nurses make a big difference, Anna.
They do. It's been a very rewarding career, and I'm proud to be a nurse.
All right, we're going to talk about the Mon Health Medical Center Family Birth Center. Tell us about the Family Birth Center. Kind of give us the broad overview of, obviously, kind of the title probably speaks for itself there, Anna, but give us the broad overview of what the center is all about.
Sure. So we are a 16-bed LDRP. So you labor, deliver, recover, and spend your postpartum period in the same room the whole time. We pride ourselves in giving that personalized care. We focus on the mom's preferences. We give evidence-based care during your entire stay so that mommy and baby see safe outcomes. We have spacious rooms. They're comfortable for the family. We offer relaxation tubs to help mom and baby and dad as well to feel more comfortable during their stay. We encourage the family to stay involved during the labor and delivery period as well as the postpartum period. And then during your stay, you're provided in that same hospital room a nurse one-on-one during your entire stay, same team of caregivers throughout your stay. This helps those families build that trusting relationship with the providers and care team.
So what is the advantage of the birthing center maybe over the traditional go to the hospital to have your baby type of scenario?
So we offer birthing suites, again, with that LDRP model where you stay in the same room, you're not transferred to a different postpartum room. And then we focus on mom's wishes and desires. The doctors are really open to giving that holistic approach, providing moms outcomes for safe delivery for mom and baby, of course. But ultimately, we try to respect mom's wishes to give her the experience that she hopes for.
You're talking about a team of individuals, practitioners helping here. So how many people are on a typical care team for mom and baby?
So there's a large group supporting you during your stay. So there's nurses, doctors, nursing assistants, surgical techs, social workers, and then we have the women in our P3 program. This doesn't mean that there's a parade that's going to be coming through your room. These are just resources that are available to us and to you as your care team 24/7 while you're here. Again, you're given that one-on-one assigned nurse specifically to you and also to your family to support you during this experience. They're going to give you that emotional support. They're going to encourage you. They're going to advocate for you during your stay for you and your baby.
Yeah.
A hot topic during labor is pain management, so that's something to note as well. We do have the option for epidurals, but we also have that natural approach too if that's something the mom desires. So we have things like nurses being trained in spinning babies, breathing techniques. We have that hydrotherapy with the tubs. We offer frequent position changes. These are all really important. And then I mentioned a social worker. So we have our P3 program. We have our inpatient social workers. These people are there to connect the families to these available outside resources that are offered in our community.
It sounds like the picture you're painting, Anna, is one of having options available, but also expertise in those options available. So mom and baby and the family can make decisions best for them and have those services and experts available to them. Is that an accurate picture?
Exactly.
Talking to Anna DeFazio, Director of Nursing, Women's Services at Mon Health Medical Center Family Birth Center. Before we take a break, can you explain some of the safety measures in place to ensure mom and baby are going to be taken care of during delivery and after the delivery as well?
Sure. So security is priority on the birth center. We work really close with Mike Walsh and our security team to keep mom and baby safe at all times. Every person that enters the birth center is responsible for showing their identification, and they also have to be badged on and off the unit by a staff member. So at any given time, I can tell you exactly who's on our unit, each individual who's present at the birth center. Once the baby is delivered, an identification band is placed on the baby, on the mom, and also on the support person. And then we also have an infant security system that each baby will be assigned to. And that way, if the baby is accidentally trying to be removed from the unit without authorization or is too close to an elevator or a door, this would lock the unit and alert staff.
Anna DeFazio, Director of Nursing, Women's Services at Mon Health Medical Center Family Birth Center. We will continue our conversation after this quick break. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Anna DeFazio, Director of Nursing, Women's Services at Mon Health Medical Center Family Birth Center. Anna, can you walk us through what patients can expect from the time they check in until the time mom and dad take the baby home?
Sure. So your overall experience really starts from the second that you first visit the clinic when you find out that you're having a baby. Tiffany and her team are there to support you from day one. But from a birth center perspective, what you can expect is you're going to check in at our check-in window. The visitor, like I said, is going to be identified. You're then going to be taken to a triage room. Typically, we'll do a weight check, vital signs, and then determine if mom is in active labor or not. If she's in labor, she's admitted to one of our 16 inpatient birthing suites. This is where she'll be assigned that one-on-one nurse as well as her physician. Immediately after delivery, the baby is assessed, and often it's right in the mom's arms if both mom and baby are stable. We call that first hour after birth, it's referred to as the golden hour. It focuses on bonding with mom, baby, and support partner. And if mom chooses to breastfeed at that time, that's often initiated during that first golden hour. Then during her postpartum stay, she stays in the same room, so she doesn't need to relocate, like I was saying, to a separate postpartum hallway. Her postpartum suite, her labor room, I guess, is cleaned up and transitioned into her postpartum suite at that time. And then during her postpartum stay, we focus on her postpartum care, education of the newborn, education on breastfeeding. We want to make sure mom and family feel comfortable to go home and care for themselves and this baby.
Yeah, that's one of the things we've often talked about on this program when we're talking about new mothers or, new families. The doctor doesn't just hand you the baby, the nurse hands you the baby and go, all right, good luck, see you later. You have support available there to help you, I guess, in that transitional stage and help you with that, big change in life where now you're responsible for taking care of this little precious human being, Anna. You don't have to do it all on your own, do you?
Right. We have an amazing support system available to all of our patients.
So in that postpartum care, what type of services are available in the postpartum care? Because we've talked about a variety of options that are available through the birthing center.
So I'm sure you've heard this mentioned on the show before, but we have our P3 program,
yes.
Progressing Through Postpartum. So we have a comprehensive follow-up program that follows a proactive outreach model, meaning we send outreach to all mothers within 4 days of delivery and then several times throughout that first month. We continue to follow up and reach out to these moms during that whole first year postpartum. Mood changes happen a lot anytime in that first year, so we want to make sure that we're following up and that we're available to these moms. The longer we leave this untreated, the longer it takes to see results.
What kind of follow-up care is available after mom, baby, dad, the family's left the hospital, they're back home? Are there still services available even after you've left the birthing center?
Absolutely. So we have our P3 support, like I was just mentioning, and then we also have our postpartum care follow-up appointment. That typically occurs around 6 weeks after delivery, but sometimes moms need to come back sooner for follow-up on blood pressure or post-delivery complications. We schedule those follow-up appointments for the mom prior to discharge, and then we can also schedule follow-up lactation consultants as needed for a mom that may be breastfeeding. Ultimately, we're here to support you and your family, whatever that may look like.
We're talking to Anna DeFazio, Director of Nursing, Women's Services at Mon Health Medical Center Family Birthing Center. Got to squeeze in another break. We'll continue our conversation and wrap things up as Mon Health Talk continues in a moment.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Anna DeFazio, Director of Nursing, Women's Services, Mon Health Medical Center Family Birth Center. Anna, what are some of the common questions, or what do you hear a lot of from mothers and families, maybe especially first-time families who come to the birthing center?
A lot of times moms are most concerned about when they're going to get to go home and also if their family is going to be able to be there to support them as visitors. We do encourage family support with restrictions, like we said, to keep both mom and baby safe, but we love to have your family there to support you.
Do you find that are they anxious? Are they excited? Is it all those emotions wrapped together leading up to the baby's arrival?
We see it all. Some are so happy. Sometimes it's scary. Other times the old pros come in. It's their fourth baby, and they could teach us a few things.
The old pros. You said, see, if I said that, I'd get in trouble, Anna. I know better. I know better. Anna DeFazio joining us here on Mon Health Talk this morning. What's the best part of getting to work at the birthing center and getting to work with expectant mothers and expectant families each and every day?
It's so rewarding to be able to be there to support these moms and families during this time. But my favorite, I always say, it's so sweet to meet your baby for the first time, but when your older baby meets your new baby, that's the cake. So I love when the siblings come in and get to meet their new baby.
I remember, vaguely remember getting to meet my younger sisters. Of course, I was mad because I was promised brothers, Anna, and I got sisters. So.
Sorry about your luck.
I guess it all worked out. For families who are expecting, Anna, and maybe they just found out, is there will your I guess OBGYN refer you over to the birthing center? Is that just a natural step? How do you get introduced to the birthing center, I guess, is my question.
So you can visit at our website to schedule your appointment. You can call the clinic to schedule your first appointment. And then once you're an established patient at the outpatient clinic, they'll refer you over to the birth center.
Is all this, do you go over all of this, I guess, once you find out you're pregnant and, going to be expecting? Is there at some point a doctor, a nurse, somebody sits down and goes, okay, here's the roadmap, I guess?
Yes, there's lots of education involved from your first visit all the way to discharge and thereafter when you have a baby. So the clinic plays a major role in those first educational pieces.
And as I emphasize just about every show here, it's not just a doctor, a nurse, but when it comes to Mon Health, it's a couple of things. It's comprehensive. It's a team effort, and it's going to be tailored to fit the patient. It's not a one-size-fits-all approach at Mon Health, and certainly not in this situation either. Right, Anna?
Exactly. We try to meet the patient's individual needs, specifically tailored to their family.
Anna DeFazio, our guest this morning, Director of Nursing at Women's Services, Mon Health Medical Center at Family Birth Center. Before we go, Anna, for folks who are listening today, what's the one important takeaway you want them to remember from today's conversation?
I want you to reach out for help if you need it during your pregnancy, and remember that we're here to provide individualized care and to give you and your family the most special, memorable experience that you can.
Anna DeFazio, Director of Nursing and Women's Services, Mon Health Medical Center at Family Birth Center. Anna, thanks so much for joining us today. Appreciate it. Enjoyed the conversation.
Thank you.